Hello. Welcome to another Friday Conversation with Experts. My name is Mara Koffmann, and I am the co-founder and CEO of Braintrust. We are a platform where parents can connect with certified teachers and learning specialists for private tutoring. And today we have Dr. Al Ravitz here talking to us about anxiety and specifically testing anxiety. And I know Al because he's my father. He spoke to us before about ADHD and medication. And today we're going to talk about this new topic, but I'll pass it over to him so he can introduce himself and then we'll jump into it.
Hello, everybody. My name's Al Ravitz. I am the proud parent of Mara Koffmann. But in addition to that, I'm also a board-certified child and adolescent psychiatrist. I worked for 30 years at the University of Chicago. I moved to New York. I worked at NYU. Then I worked at a place called the Child Mind Institute. And for the last 5 years or so, I've been liberated and I'm in private practice doing child and adolescent psychiatry. So Mara asked me to talk about test anxiety. How do you evaluate it? How do you treat it? I'm going to tell you some of the obvious things, and then I'm going to tell you a few of the things that I've learned from my own experience, and then we'll talk about strategies for addressing the problem. First of all, you want to do a careful diagnostic assessment, because sometimes people just have test anxiety. Sometimes people have generalized anxiety disorder or obsessive-compulsive disorder or post-traumatic stress disorder or attention deficit disorder, all of which may interfere in various ways with test performance. And Mara, listen to this so you can ask me clarifying questions. All right. In addition to that,
ask you a question now before you even go further. So lots of kids feel anxiety about tests. And lots of kids will complain about it before tests. I know I certainly did when I was young, and you would always just tell me.
Oh, I can remember that. Yes. Yeah, I tell you to get over yourself. So, such a sensitive parent. Yeah, right.
in thinking about this, how can parents identify whether the anxiety or the nerves that a child is feeling are intense enough that they warrant seeking out the help of a professional, or if it's something that's simply the normal type of nervousness that all of us feel before we have to do something big and important?
It's appropriate to have a little bit of anxiety before you do something big and important, because it's going to focus your attention and it's going to organize your thinking. If the anxiety is so devastating that somebody has a panic attack, which means that he or she feels like they can't breathe, like their chest is really tight, like they have chest pain, they feel they're going to faint, things like that. That anxiety is going to be so sort of disruptive that people are not going to be able to function adequately. So, I mean, the bottom line is everybody should feel a little bit anxious before a test, but if the anxiety interferes with performance, then you need to treat it. That's what I would say. And so I named a number of different kinds of diagnoses. So generalized anxiety disorder is something, it refers to a kind of clinical status in which a person feels anxious most of the time. They're not necessarily sure what they feel anxious about, but they kind of have some anxiety about the future. They have some anxiety about their presentation, their social presentation. They have some anxiety about whether or not people think they're smart enough, things like that. Generalized anxiety doesn't necessarily result in test anxiety, but generalized anxiety certainly makes people more vulnerable to establishing a pattern in which they can't perform. Obsessive-compulsive disorder usually doesn't manifest as test anxiety, but if somebody is sufficiently perfectionistic that they can't accept anything other than 100%, or at least an A, they may not be able to perform because the stakes are so high. People with PTSD have been traumatized in certain ways by teachers who have unreasonable expectations of them. I think you had a history teacher who you said traumatized you like that. And sometimes they're traumatized by their parents. I'm going to talk a little bit more about this in a minute, but there are some parents who, when they help with homework, they have unrealistic expectations about how much a kid can do and how well a kid can perform. And if those parents become excessively critical during homework sessions, then the child can feel unreasonably judged, and the child will have a thought, something like, oh my goodness, if I don't do well on this test, my mother/father is going to yell at me, call me stupid, tell me that I'm not working hard enough, tell me that I'm lazy, and then they just freeze up. So those are some of the types of problems that kids can have. Now, in addition to that, people with ADHD have a history of doing poorly on tests because they're not paying attention. And this becomes progressively more problematic as they progress in their academic careers. I see a lot of kids with ADHD who everybody knew that they were anxious, but they have enough raw brain power that they can get by with inattention and distractibility until the academic expectations rise to the point where they can no longer perform without doing homework. Okay.
And I think a lot of times too, what we see with kids who have ADHD is that the executive function skills required for studying effectively and organizing that information in a way that's going to be easily accessible during the test becomes really, really difficult, which then creates this sort of self-fulfilling prophecy where they get anxious about the tests and then they don't do well on the tests, and then they become more anxious about the next test because they don't understand how to study and prepare for a test.
Well, I mean, that was another thing that I was going to talk about. And so when I talk about doing a diagnostic assessment, it's me asking a lot of questions about developmental history and about family history, because there are certain types of genetic vulnerabilities. If a parent has some kind of a learning disability, or if a parent has an anxiety disorder, then a child is at much greater genetic risk for developing these things. But I don't just get that kind of information. The other information that I think is really important has to do with things like, what is the family attitude about accomplishment, about what kind of grades are tolerable for the parents? Are parents unhappy unless a child gets straight A's? Are parents super successful, type A personalities? Their kid is a little bit more easygoing. And let's say their kid has 10 less IQ points than mom and dad. Do parents have realistic expectations that the child is going to perform exactly as the parents did? You also want to get an idea of what is the child's academic history. So is there already a pattern of inadequate performance? And when I say inadequate, I'm talking about inadequate in terms of family expectations. You also want to figure out how kids do socially, because depending on the peer group that a child is affiliated with, grades are either more important or less important. So sometimes kids hang out with a very high achieving group of other kids, and then they become panicked that if they don't do well enough academically, they're going to lose their friend circle, which is really a problem. Okay, and then I ask about study habits, because I want to know how a kid studies. Does the kid study with his parent and the parents yelling at the kid? Does the kid study by himself, in which a situation in which there may be little or no supervision or expectation, no one's checking? So I want to understand study habits. And then finally, so after I've gotten all this kind of psychosocial information, it's really important if a kid has test anxiety, it's really important to do neuropsychological testing because you want to figure out how the child processes information. There are lots of kids who have very high verbal IQs but have very slow processing speed. Sometimes the problem can be solved by simply allowing the kid to have time and a half or double time on tests. Other times, there are real learning differences, and kids have difficulty processing certain type of information. If that's the case, then they need some type of help, whether it be tutoring or psychoeducational intervention of some sort. They may need that. Okay, so that's the other thing that's really important is some type of neuropsychological testing. And it's important for families to understand that it is the school district's obligation to provide this type of testing at no cost to the family, because it's the school district's obligation to provide what's called an appropriate educational program. Not the best, but something that's appropriate. And if a child is struggling in school, but otherwise appears to be reasonably intelligent and reasonably competent, it's up to the school to evaluate that kid. And the school can do things like neuropsychological testing, which is often very expensive if you go to private providers.
And I will also say that there's that difference between students that generally do okay, but then they have a test and all of a sudden their performance on the test is drastically different than their performance on all of the assignments leading up to the test. And right. For those kids,
or that, and I'll let you finish in a second, or that they do poorly only in math, or only in English, or only in foreign languages, and they do well in everything else, and they're only panicked when they have to be assessed in those specific subject areas.
So there's these sorts of varying degrees. I just think of that example of the student that does well on the assignments, but then bombs a test or bombs a big assessment. I mean, that seems like a major indicator that it perhaps isn't a generalized sort of difficulty with learning or with the material, but more feelings that either difficulties or anxiety related specifically to assessment and test taking as an isolated part of their responsibilities as a student. And that seems like that would require more of a targeted approach to address that specific anxiety rather than more these sorts of like learning interventions or other sorts of approaches that would be working on them, working to support them more globally or holistically rather than in this targeted specific kind of a way.
Yes, I agree. That's a very good point. Yeah.
So if a student has that sort of specific anxiety around tests and test taking that doesn't necessarily have to do with any sort of generalized learning disability or generalized anxiety in general, what are your recommendations for supporting students that struggle specifically with test taking?
Okay, so I would say that there are 2 or 3 types of psychotherapeutic interventions. First of all, you want to do that assessment of the family to make sure that the anxiety isn't related to how the performance looks to the family. Okay, so you just want to talk a little bit about that with parents. And you also want to...
Is that something that parents can talk about, if they don't seek out the help of a doctor, and this is just something that parents are seeing? Would you encourage families to have that kind of a conversation together before they bring in a doctor or other sort of professional into the fold to try and address the anxiety?
Yes, but sometimes, yes, I think a frank discussion like that can be very helpful, but oftentimes the child, the student, is reluctant to confront the parents for fear of angering them or disappointing them.
Mm.
But yes, sometimes that's all it takes is an honest family conversation. And sometimes it works better if the parents can bring it up and say, are we doing anything that makes it difficult for you to perform in school? Or do you feel our expectations are unreasonably high? Do you feel that our interventions with you are unreasonably harsh? Or do you feel like you could benefit from more participation from us? Yes, those kinds of discussions are very helpful. And so when I talk about the first step in the intervention is discussing it with the family, yes, okay. Then let's say that there is a specific type of anxiety that relates to performance on testing. Number one, you want to make sure that you don't have a more generalized anxiety disorder, and this requires a series of questions. If there is a more generalized type of anxiety disorder, something like cognitive behavioral therapy, which is a specific type of psychotherapy, for those of you out there who aren't experts in evidence-based psychological and psychiatric treatments, cognitive behavioral therapy just helps people to change the way that they think about things. So instead of going into a test and assuming I'm stupid, I'm going to do terrible, a therapist helps that kid think about, well, is that rational? Are you really stupid in every area of your life? And then the kid says, well, no. And then they work on developing a new way of thinking about the test taking situation. And it's just important to understand that CBT is different than what you might see on TV in terms of psychotherapy. It's not a kid sitting down there and saying, oh, my parents are so terrible. I was traumatized by my childhood. I've got all these deep-seated psychological problems. Sometimes it's simply addressing certain types of irrational thinking about specific areas of function. Now, in addition to
it's a short-term treatment as well. It's very targeted. Short-term.
It's usually 10 to 20 sessions should do it. Okay. And then in addition to that, there is something that's called exposure response prevention. Now, we use exposure response prevention to treat obsessive compulsive disorder a lot, because obsessive compulsive disorder is sort of like having certain types of irrational fears. If I don't count to 10 before I take my next breath, I may have a heart attack. So with exposure response prevention, you force the patient to not count to 10 before taking a breath. And the patient finds out that she doesn't have a heart attack, that the sky doesn't fall. So you have an exposure, and then you prevent the response, and then the person eventually learns, okay, that was an irrational superstition of mine that isn't based on any kind of real data. So let's change it. And you do the same thing with exposure response prevention with test situations. All right. And there are plenty of people in most locales that can do this. All right. Now, those are the basic types of psychotherapeutic interventions. I just need to, for completeness, add that there are also meds that we can use to either longer-term medication treatment of generalized anxiety or obsessive-compulsive disorder or post-traumatic stress disorder. These are not addictive. They are not drugs of abuse, but they are often effective, and that's a longer-term strategy for treating anxiety in general. But there are also a few meds that we can use to, on an as-needed basis, to treat performance anxiety. There are some that just serve to alleviate anxiety in general, and there are some that simply interfere with the physiological manifestations of anxiety. So Your heart doesn't beat fast. You don't feel sweaty. You don't feel like you can't breathe. Your chest isn't tight. And what happens is there's a positive feedback loop. When you begin to have those physiological responses, then you begin to panic. Oh my God, I'm getting really anxious. I'm not going to be able to do this. Stop me, stop me. We use these types of meds a lot with actors and actresses who have stage fright. Again, they are not addictive. They are not drugs of abuse. In fact, you can't abuse them. They don't do anything other than slow your heart down a little bit. So there are medical interventions, but I think step one is always a type of environmental and psychological intervention. And if that doesn't work, then we do have some meds that we can use that help with that.
And then there's also just basic, I mean, I know that when I would feel anxious, the recommendation was always try and take some deep breaths and calm yourself down, and teaching kids the strategies that will help them to mimic the response that that drug might create, of just learning how to calm down your heart, learning how to quiet your mind so that all of those worrying thoughts don't become so overwhelming, because you're able to either use mindfulness strategies or breathing in
Right.
order to create that type of response on your own within your body.
Yes, once again, I would say I absolutely agree with you, and I forgot to say that. But yes, that's absolutely true. Teaching general relaxation techniques is often very helpful, and meditation is often very helpful. You want to find a way to calm yourself when you're anxious and scared.
Yeah.
Because you're going to function better.
Right. And that's helpful for taking tests, but it's also helpful for so many other things. And
life in general.
Exactly.
Is better if you're not a nervous wreck. Yes.
Yes. So, I think teaching students these things earlier on it's almost like a proactive tool to help to manage those anxieties or those feelings that are likely to come about in some way, shape, or form for other things in their life. So that seems like a really useful strategy.
And in this day and age, there are tons of iPhone and Android apps that people can use to learn these types of relaxation and meditation techniques. So it's not like you have to see a doc and pay a ton of money to learn this. A lot of times you can just pick up your phone, find the right app, just look up meditation apps or relaxation apps, and there'll be a whole slew of them, and they'll all be rated with stars, and you'll figure out which is the best one for you.
Yeah, and I think that in my experience, a lot of families tend to have more success helping their kids do this if it becomes a family activity where the parents can also participate with the child and just highlight that this is good for everybody, and it's not something weird, or it's not something wrong with them. It's not something, that they just have to learn, but rather it's a good thing to have under your belt no matter what. I certainly aspire to do it and never quite find the time that I need. But I think if you have a child that's displaying any of those symptoms or behaviors, if you can do it as a family, it's certainly going to promote betterment and wellness for all of the participants.
And I think that brings up just one other point, which is that you want to try to normalize this stuff. You don't want kids to think that they're freaks or losers because they struggle with tests. It needs to be, it's a very common problem. And as I said, everybody should be a little bit anxious about tests. And the problem is that if you're too anxious, you can't perform. But it's got to be normalized. Yes.
Yeah. And it's a good conversation to have. I know that we talk about that a lot with students during tutoring sessions. And I think it's a great thing for kids to hear that, the straight A student who went to Harvard and, has accomplished all of these wonderful things also struggled with feeling nervous before tests and how to manage those emotions, that it's a common thing that isn't necessarily commonly discussed. And so having a safe space in which to talk about those things and work on addressing them, either with peers or with somebody in school or with your family or with a doctor, just beginning that conversation is a really important first step towards helping kids feel more comfortable and confident that there are things that they can do to overcome these challenges that are totally within their reach. And, will make school a lot easier on so many different levels.
Will make life easier if you don't have performance anxiety, if you don't have debilitating performance anxiety. I mean, if we had performance anxiety, we couldn't be doing this, right?
Yeah. Yes. Well, yes. And so as the product of Dr. Ravitz and a maniacal student who had a lot of anxiety around school, I was happy to be able to talk about this. And, I hope that all of the students that we work with can engage in that same discussion. And, for all of you parents watching, if you see your child struggling, I think a really important first step that you can take is just talk to them about why they're having a hard time. If it has to do with specific tests, if it has to do with anything that a parent is doing or a pressure that they feel, because addressing it, naming it, and beginning that dialogue is the first step towards coming up with a solution.
Indeed.
On that note, thank you, Dad, for talking to us about the topic. And you can learn more about today's conversation and the topic by visiting our blog at www.braintrusttutors.com with those 2 T's. And if you need to find a wonderful teacher to help you help your child, we've got a team of incredible educators who have tons of experience doing just that. Thank you.
Thank you. Bye-bye.